CataractCoach.com. The surgeon's loyalty is critical, and this lesson is going to make you a better surgeon. You know, my podcast with Shannon Wong, which you'll see tomorrow on my channel here, Shannon brought up an important topic, and that is, should a surgeon be loyal to any one specific ophthalmic company? You know, the big players in our field, Bausch & Lomb, Johnson & Johnson, which is formerly AMO or Abbott, and also Alcon. Those are probably the three big players. There are many other smaller players. There are many ophthalmic companies. And I think the surgeon should first be loyal to the patient. So as a surgeon, my number one loyalty is to my patient. I'm always going to choose the technique or technology that's going to be the best for my specific patient. I want to tailor my surgery to that patient to give the patient the best possible outcome. That's my only motivating factor. Number two, I think the surgeon needs to be loyal to his clinic, his staff, and himself or herself. That's very important. And you know, one of those things is that you take pride in your work, you deliver the best possible outcome, and you give the same treatment you would want to receive. And I think the answer is no. Don't be loyal to any one specific company. Don't be in love with one ophthalmic company. Like them all. I think you should have access to companies across the spectrum. Don't just carry one IOL in your surgery center. Have access, whether it's in stock or by ordering, to all different IOLs. I want to have the experience of learning to use every different possible IOL, technique, tool, instrumentation, technology, whatever it is. I want to have access to everything. So when anything new comes, I definitely have to learn how to use it, because you never know which of these things are going to be so important and so favored in your hands and for your patients. And you don't want to be stuck in the conundrum of doing the same surgery you learned in your residency 10, 20, or 30 years ago. You've got to keep evolving your technique, and that also means evolving the technologies that you use. So when a new lens comes onto the market, I definitely need to study it. I want to see any of the manufacturer's directions for use, DFU. Are there any studies that you can send me? Send me the original FDA studies that you submitted. I'll ask the companies. I want to see the studies. I want to learn them. I want to study them inside and out. I want to know exactly what is offered here. And then once I'm familiar with the product, I can determine which of my patients would be well suited for it. And then I can use those products for my patients to give them, again, a tailored outcome that they desire. And so having full access is important. So remember, you want more tools in your toolbox, not fewer. Yes, you may have some favorite tools that you use more than others, but you need to still have the whole spectrum of tools from all different companies. And that's going to allow you to give your patients the very best. So number one loyalty as a surgeon, your loyalty is number one, that patient. You are loyal to your patient. And that means you use your knowledge and your experience to give that patient the very best for her eye or his eye in order to give the great outcomes. And that's actually how you build your reputation. And also, it's fun to use many different products and have that expertise. If you're an artist, you don't want to just paint every painting with just the one same paintbrush or the one simple set of colors. You want to have some variety there. And then same with surgery. You want to be able to offer, like for this patient's getting an eye-enhanced toric monofocal lens. So this patient didn't want to have a true extended depth of focus lens, but wanted to see if they could pinch out a little tiny bit of extra far intermediate vision at about let's say a meter away from the face. And I think this lens will deliver on that regard. You can see we're just lining up the toric marks here with the marks on the cornea, and we'll finish up this case. And so keep in mind, you definitely have to be loyal to your patients. The companies will wine you and dine you and take you out and have a good time, and they'll be your friend, and God bless them. We need to have access to all their products, and we want to work together with them. I encourage you, if you're a young ophthalmologist in your 30s or 40s, work with industry. Work with them to design the next generation of products. What are your great ideas that you have there? Let's work together, design the products that you would want to use. And that means a lot. So work with these companies, get your name there, get your ideas across. But again, don't be in love with just one company. Like all of them. Instead, be loyal to your patients and then loyal to your clinic and your staff and yourself. And the companies, honestly, it's what they want. Great products like this will stand on their own merits. And whatever the company tells you in marketing, remember, you've got to figure out clinically what actually makes the most sense. So thanks for watching. And remember, loyalty always to your patients is number one.